The Marietta School District is making some changes to keep the virus in check after a study found that teachers, not students, were playing a central role in how the virus spread.
The realization came after the district partnered with the CDC to analyze some clusters in its elementary schools. Joe Hankey spoke to the superintendent today about the changes now in place.
Our priority was really two-part. One, what can we learn about potential school-based transmission? And then second, as a result of that, what are the additional safety protocols that we can take to protect our students and staff?
Marietta City School Superintendent Grant Rivera walked through his schools in December and January, alongside CDC staff studying 9 clusters of COVID cases, with 8 involving probable teacher-to-student transmission.
As part of this study, there were some mid-course corrections that we made in very early January as we started to notice some patterns regarding adult-to-adult potential school-based transmission.
Here are some of the changes. While Marietta students studied remotely on Fridays, teachers still went to schools and worked collaboratively at times. Now, teachers work at home on Fridays. All meetings are virtual, chairs have been removed from teacher workrooms, and teachers are not to eat together inside. While Marietta required masks, including outside if distancing is not possible, the CDC found moments of inadequate mask wearing likely added to some of the clusters of cases.
I do believe the masks are consistently worn. However, we also acknowledge that if and when, for any reason they're not, be it one child or in an activity or otherwise, that creates a risk.
Some changes specific to students. The school spread desks in some classrooms even further out, and small group learning with a few students and a teacher is now limited to under 15 minutes compared to as much as 30 before, with teachers now standing further back.
This CDC report validates the importance of adults being vaccinated.
Rivera told me he recognizes being vaccinated as a very personal choice. Recently, Marietta City Schools surveyed its staff and asked who wants to and who does not want to be vaccinated. I'll have those results and also details of how the district is addressing any hesitancy issues with regards to the vaccine coming up at 6.
All right, Joe, we'll see more from you at 6 then.